Okay. All right. So we just got back from 3 weeks, not 3 weeks, a little less than 2 weeks in Sedona, where Jordan and I were taking continuing education classes on myofascial release, specifically John Barnes' approach to myofascial release. We're going to, throughout this episode, we're going to abbreviate myofascial release MFR because it's a bit of a mouthful. And we wanted to share with our audience what myofascial release is, at least this specific type of myofascial release approach, what it is, how it helps, and how it has affected both of our lives. So we're just getting started on this podcast. If you haven't already, please hit the subscribe button and please rate and review as well.
Yeah, we definitely want to know what people are liking, what they're interested in, and all that kind of stuff.
So let's begin.
All right.
Do you want to talk about what myofascial release is?
So my first exposure, I guess, to myofascial release was really with you and you treating me. And I know right off the bat she was doing abdominal work on me, so releasing the fascia like throughout my abdomen. And I remember in that session you also working up to my chest. And I remember, and I've always, been a little bit in the energy world and, knowing that how much our emotions and past traumas and experiences play a role in what gets manifested with our physical body, and how our physical body kind of is showing up in the world as who we are right now is based on all these things. And I remember when I was laying on the table, just like this welling feeling happening where I was almost like, I didn't know what emotion it was. I didn't know what memory it was. But as I kind of just kept letting go of control and like out of curiosity, like, what is this? Like allowing it to come through. I remember just crying profusely, and you kind of just kept doing the work. You weren't trying to quiet me down. And that's something I really appreciated. And I realized going to this seminar too, like a lot of times when people show emotion or they get upset, we automatically want to give them a tissue and be like, oh, it's okay, and almost kind of like quiet them down. But really, like, you're stopping that experience from happening. You're stopping them from getting that full emotional release. And I think a big part of why we do that is just, and I know John Barnes said this too, like our own uncomfortability with somebody being upset. And in, just societal norms is like, oh, try and make that person feel better. When it's like, no, just allow that person to experience what they need to experience. So I just remember in our session having this emotional release and crying for probably like 5 or 10 minutes and snot's going everywhere. And I remember after we'd finished the session just being like, wow, like, where did that come from? And the other thing I noticed right away after, and you'd, I think, done about 3 sessions on me, and after every session you'd done where you worked on my abdomen, I had fantastic bowel movements. And I know for me, why this is so kind of like, and critical is because I grew up having terrible GI issues. I was on the floor in pain for hours after eating growing up, and my mom took me to see all these specialists that try to tell me I had Crohn's disease or this or that. And knowing what I know now after going through my whole gut health journey, kind of middle of chiropractic school, and now working with tons of people with gut health issues, realizing that I probably have so much scarring of the tissues in my abdomen from all the inflammation over how many years that I basically was dealing with like a really like acute but constant symptoms. And I know you had always said how like anytime you work on my abdomen, like you can feel how stiff my abdomen feels. And I think a lot of us would think like, oh, we have a strong core, oh, it's tight or whatever. And it's like, no, like tissues are meant to be soft, especially when they're not like in a contracted state. And so I'm realizing now how much fascial work can play a role and already has played a role on my digestive health and the digestive issues I've had. And so I know that's something, even just from working with you and now taking the seminar and learning more from John about how when we have these fascial restrictions and we're working on nutrition, we might be taking all these supplements, doing all this stuff to make changes to our diet, and we may only see potentially minimal response, or may not even just be getting the full effect out of it. Maybe we're seeing positive changes, but we may not even be getting the full effect, because when that fascia is locked down, and we learned about this in the seminar too, like the fluid matrix that runs through the fascia stiffens and hardens, and it becomes very like gel-like, and then it can even crystallize. And once these things happen and there's that much compression on the fascia, especially I think about the abdomen absorbing nutrients and getting rid of toxins, like that process can't happen as easily. So that's why I'm saying, like, getting this kind of work done, I think, is only going to help nutrition patients, and that's anyone having gut health issues, not just specifically working with me, but getting this kind of work done. It could even potentially, I think, has the potential to resolve almost a lot of their issues. Because think about it, if the body now has the ability to like remove toxins on its own now and take up more nutrients, like why wouldn't it heal? Like that's the whole body's trying to always just stay in homeostasis and be healthy.
Right. I want to comment on a few things that you said, but before I do that, explain basically what the fascial system is and what myofascial release is.
I went down the rabbit hole. I got excited.
So myofascial release is a type of body work where the practitioner, usually a physical therapist, occupational therapist, massage therapist, or other healthcare provider.
They even let chiropractors.
Yeah.
She loves to give me crap. But anyway, keep going.
Yeah, that usually one of those people, it's a body work done by the people listed that is very different from massage. And I say all the time to Jordan that I have a hard time explaining what it is, and because you just have to experience it. So I'm going to explain what it isn't first. So think of traditional massage. Most of us have had some sort of massage, whether that be from a professional or a friend or a significant other did it on us, or a parent, where the person doing it is gliding or sliding along the skin, and it could be at variable depths. So there could be a deep tissue massage versus not as aggressive, or a light soft tissue mobilization. And the person doing it is dynamic, so sinking into the tissue and moving. This is great for breaking up cross links, which is a part of the skeletal muscle unit. And sometimes those just get sticky. And so digging in and going across or gliding across can break that up.
And we even learned too that the fascia creates cross links. So not even just like musculature, but like the fascia itself. So yeah.
And I can say that I don't really respond well to massage, but while it's great, it addresses the elastin fibers and the muscle, or the smooth muscle, the skeletal muscle cell.
And it can have, I think about like increasing blood flow to an area, like some of those other potential benefit effects.
But the speed and the technique of putting force through the body addresses certain tissues within the body.
Yes.
The difference with myofascial release is if you're treated by a practitioner trained under this methodology, you're going to notice that it's very different than traditional massage. So the therapist sinks into what is called the depth barrier, and then without sliding, moves their hands or moves in a way that is going to create tension across the other barriers of the tissue. And once there's resistance and that tissue doesn't move, they wait there for a minimum of 5 minutes. It's typically longer because that is the time that is needed. There's a time-dependent piece to this for certain cellular processes to occur. So unlike massage, myofascial release addresses the muscular portion, the elastic fiber portion of the elastin, as well as the ground substance part of the cell. Ground substance is such a big piece of every cellular unit of each cell in our body.
Well, because it's basically our body's version of water, right? How we convert it, and we're pretty much majority of us is water.
Right. So at this point in time, so once you hit this time component, and it's just because it's a 5, we have this number 5, that's minimum. It may take longer depending on an area of the body or the person, but certain factors that are key for healing factors, are released from the cell, and that's where the change happens. So a lot of times people after massage complain, well, I felt good that day, or I felt good a couple hours, but then the problem came back shortly after. With myofascial release, the number one question people ask me is, well, is it going to just go back? And I say, no. And I experienced this, A, as a patient, and B, as the provider, and continually assessing the person. It's kind of like if you picture a waveform, it's like you go up, and then there's a dip. You don't go all the way back to your baseline. It's just this upward trajectory. And you don't really go back unless you're not doing anything for yourself in between visits. So we teach you how to self-treat in between sessions, because we're only seeing you for such a short period of time compared to the time that you spend by yourself or spend on your own. And that's really key to the whole process. So what fascia is a tissue in our body that surrounds every cell. A group of cells collectively are known as tissue. The fascia surrounds every tissue. A group of tissues together form an organ, so it surrounds every organ, and a group of organs form a system, and the fascia surrounds every system. Yeah. And it is, when we think of like our structure of our body, we think of our bones and our joints being like what takes the brunt of the force. And really, it isn't the bones that do all the heavy lifting, it's the fascial system. The fascial system act as like the guide wires. Picture a camping tent. Have you ever set up a camping tent that you don't set it up correctly and you don't have the tension system? And that tent is like really at a vulnerable state and likely going to come down. The fascial system are the guide wires of a well set up tent. Now, just by living our life, we're exposed to different toxins that are going to create an inflammatory response in our body. I bring that up because the next question people have was, what are myofascial restrictions? So myofascial restrictions are when there's an inflammatory response in our body, either from physical injury, from illness, from surgery, or from some physiologic stress. That could be emotional stress.
Yeah, it can be.
And just being in this hypervigilant state, not being able to come down from this like fight or flight nervous system state, like so many of us are in this modern day society. So when these restrictions form, they create snags in the system. So picture a sweater, a cashmere sweater. You snag in one area, but eventually it affects the whole dang sweater. Or I like the pantyhose analogy. When you get a snag, if you don't stop that snag with alcohol, then you get a runner, and then it affects the whole dang pantyhose. Yeah. So when someone has a surgery or an injury somewhere and it's not addressed, like the fascial system is not addressed there, that can lead to issues.
And they may not directly experience, again, like pain around where, let's say, the injury site was. Or again, like think about little kids falling on their butt all the time. Like there is still a small amount of tissue trauma that's happening, and over time, right, kids fall enough, but when these things aren't addressed, that's potentially where the snag is. But then over time, they keep growing, their system keeps developing, and now they're getting tension in other places of the body, but the snag was really like in this area.
Yeah. So the problem with these fascial restrictions, the problems, I should say, are what I regularly am talking about with my patients is, one, the fluidity that should be within this tissue, instead of being like watery, it becomes more viscousy. So, and then eventually like sap, it crystallizes, and then the cells can't absorb nutrients to appropriately function.
And all your tissues, they need oxygen, they need nutrients, they need all of that to stay healthy and keep repairing and keep going.
Right. Second is once they harden, we begin to form axes of motion around these restricted sites. So think of, I think the easiest example for a lot of people that would listen to this, at least that I'm connected with, would be your C-section scar. I talk about you don't want to form axes of motion around the scar because that is going to completely impact your core function. That can happen anywhere, and it doesn't have to be this humongous scar. It could be it could be just sites of fascial restrictions.
Yeah. And I would like also for me as a chiropractor and learning like craniosacral techniques and stuff like that, knowing how interconnected through our skull all the way down through our spine into our pelvis, having dura, which dura is essentially part of the fascial system. And so basically you have this thin sheet that basically runs around, helps kind of, again, keep things connected to each other, like your brain to your skull, but it's like that middle layer. And you also have all your ventricles and things that help drain and bring nutrients in, take toxins out. Those parts that run through your brain also are connected to that fascial system. So this thing runs all the way through your skull. It runs all the way down your spine and then into your pelvis, and like even right attaching, I think, what is it, like S2, like midway part of the sacrum.
Yep.
But again, even the coccyx then attaches to the sacrum, so having restrictions there can affect even like the coccyx, let's say. But what I think is so interesting is, I think
tailbone, coccyx being
sorry.
tailbone.
But what I think is so interesting is how many athletes I know who have hit their head, have head traumas, even little kids, how many times we hit our head on stuff. And because our cranial bones, especially when we're young, those sutures are so loose essentially and have so much give, because as you get older, those sutures just become tighter and tighter. It doesn't mean they lose the ability to completely move. They just become tighter and a little more restricted. But especially as kids, let's say hitting your head or whatever, and you have any sort of torsion, or even what we talk about like with you with birthing, right? And these kids being pulled out with forceps and having traumas that the medical doctors aren't necessarily talking about, but your kids being pulled out by these forceps, this abnormal thing, they're going to have cranial bones that shift. That's why also babies come out with abnormal shaped heads and stuff like that. And can even be from the birthing canals too tight, right? And now they come out with a little bit more of a cone shape. But either way, what's happening with those cranial bones shifting, the dura is now also getting restricted. You have now a point of tension that is going to not just stay in that area, but it's going to affect its connection points all the way down to the bottom of the spine. So you may start out with having, let's say, some of these minor, hit your head or whatever, and it's not a big deal. You didn't have any crazy symptoms, but later on in life, you start developing low back pain. You start developing other like pelvic floor issues, and it could also be like, you're having symptoms there, but it's related potentially to the dura, again,
right,
being restricted at your skull level or through a part of your spine. So I just thought think it's so interesting how it's like, it seems like so much of the time where we're having pain and issues, yes, things need to be cleared up there, but it wasn't even like the root that kind of caused those things to come on.
So going back to what Jordan was talking about earlier, is when she came to see me, I feel her abdominal wall, and I'm like, her muscles were just like, she wasn't contracting, but the tissue was just overactive, and she couldn't figure out how to relax it. And like traditional breathing or relaxation techniques weren't really doing it. And by this point, we had already established a professional relationship, in that a lot of my patients have food sensitivities and have just underlying infections going on in their body. And when we refer to each other, basically, I didn't say this to her, that this is what I tell your patients, but for them to get the most out of, for someone to get the most out of the work that Jordan's doing from a nutritional standpoint, their body has to be capable of absorbing it. And a lot of people that have been referred from Jordan to me, they come in and I feel their abdominal wall and I feel their system, and it feels like hard. And when I said we need to open up the system with myofascial release, that's what I was talking about. So she got to experience it, and until experiencing it from a patient standpoint is absolutely key. But then when you go through the training, your eyes are just completely open and your mind is blown.
Well, because 11 days of just education, but also hands-on work. We're treating each other throughout the entire seminar.
Yeah. So I want to share how my story with myofascial release. I've been doing this for several years now, and then I want you to share yours.
Okay.
But I was on the brink of I was so symptomatic in my pelvic floor that I could barely stand up and walk.
What were some of the symptoms?
So years ago, this was in 2019, I felt like I had a bowling ball in my vagina. It was so heavy, and it was aggravated by CrossFit, weightlifting at my gym. And then, so I was a 5 a.m., I went to 5 a.m., and then I would be just so uncomfortable for the rest of the day. And I couldn't just not go to work. So there would be days where I would use these disposable pessaries from Poison pessaries, which are kind of like tampons with a gate in it. Not good to be using on a daily basis, but to alleviate the pressure. And then I would be on my period and I'd have to use a tampon, so I'd always have something in my vagina. It was madness. And so my gym, the CrossFit is just my community, it's my social life, it was so much to me. So to have to step away, it was really hard, and I felt like I was just spinning. So I had sought out a pelvic floor physical therapist specifically trained in John Barnes' myofascial release approach, because across the years, whenever I was going through my specialized training, the therapist was like, make sure you do this, make sure you do this. And I remembered that, and I was in a business mastermind retreat, and the table of ladies that I was sitting with, they all were John Barnes trained, and they were taking a look at me and they're like, yeah, you need to see an MFR trained therapist. Here's a name. So that was my introduction to MFR out in Arizona. And so I go and I'm lying there and they're doing the work. I'm just wondering what the heck is happening. I feel stuff, but it's just different than any other body work that I've ever had. And as I'm sitting there, I'm having all these things pop up in my mind's eye, memories. And I'm like, why am I thinking it? Why are these things coming up? And I didn't think to even mention them to whoever was treating me. And I was just really, it was really interesting. That's the only way I can describe it. 2 sessions of the MFR work, I had none of those symptoms vaginally, none. And I'm like, okay, as a professional that's a pelvic PT, I know that once the symptoms are gone, that's just the beginning. That's where people go wrong. They're like, oh, my symptoms are gone, I'm good. No, that's just the beginning. But I will say after 2 sessions, that heaviness was gone, and it is now, how many years later? It's 2020, it was 2019, now it's 2023. It'll be going on 4 years come November. I have not had those symptoms since. Now, after a few more sessions, I think I went weekly for 8 visits. I started going back to the gym, and I was feeling so good. It felt I wasn't that heavy. I was probably what I am now, 125 pounds. It felt like when I was moving before that I was way heavier. And so I get there, and I remember this specifically because I was just mind blown. We were at the gym doing squat cleans, and I hadn't been going to the gym really for like a month at that point. So I wasn't practicing the squat clean. And also, I had not done or practiced a squat clean since that summer. It was like power clean, so less depth. And my max up till that point, and I'd been doing CrossFit for about 4 years at that point, it was 135 pounds. That day, I felt so good that I'm like, oh, let's just test the waters here. And I easily, I think I still have the video, easily hit 145 pounds. And the technique was the best that I have had that point. But the ease of it was just so smooth and so unlabored. And that was what really, I mean, I was already bought in, but I'm like, wow, what else can I achieve? I never knew how good I could feel until that. So I think a lot of people, I didn't have a lot of, after the heaviness, I didn't really have any issues or pain anywhere, but I also didn't know how good I truly could feel.
Yeah.
And so whenever I was in a session, they weren't just in my pelvic floor, it was a whole body thing. And each time I would go, I'd have these like things come up and I'd get emotional and I'd apologize, like, I'm sorry, I don't know why I'm crying, but I'm crying. And only to realize, like, I just knew that this was the missing piece in my career. And in fact, I almost left physical therapy in general because I was I was recommending dietary changes. I was recommending different like lifestyle factors for my patients, and they were doing them and they were still not getting better. And I was just like, I'd rather just like be in fitness because I just can't help people with pelvic pain or this chronic pain. It wasn't working. And then I found this as a patient, and I'm like, oh, obviously I have to go to training now. So I did. And that, learning MFR totally changed my effectiveness with every single one of my patients. So in addition, what other hurdle that I ran into from a provider standpoint was, I mean, one thing that I'm spot on is teaching people how to move differently by teaching them how to reconnect to their core. I mean, I don't care who you are. I don't care what your background is. I don't care how many problems you had learning this exercise from this person. I will help you get it down.
And I will attest to that is true. You are the best core physician I have ever met. Like, I've met a lot of doctors. I've met a lot of sports doctors. I've met a lot of PTs, even honestly, a decent amount of pelvic floor PTs up to this point. And I have not met anyone who knows the core as well as you do and how to actually get people to know how to use it properly and like change their life and change their movement.
I don't like talking about myself, but this is one area that I'm really confident
Talk it up. You're so you're so good at it, honestly. Like,
anyways, there was a point though where I wasn't able, I'm like, why in the world are these people not able to connect here? It doesn't make any sense. It didn't at the time, but I wasn't assessing the fascial system. And the problem was okay, so here's another thing about the fascia. When it's restricted, it has the capability of exerting 2,000 pounds per square inch of pressure on an area in the body. Just think about that, like 2,000 pounds per square inch.
That's like having a horse and a half sitting on you in one area.
Yeah. And so how in the world, our body is insane at compensating. And I say that in a good way. It learns how to compensate.
Yeah.
But the areas that are not able to move because of those restrictions are going to include vessels, nerves, muscle tissue, all different types of tissues. Well, it's no wonder why they couldn't connect.
Yeah.
And so finding MFR not only helped the people with the pain problems, but it also changed my effectiveness in getting people to connect to areas of their body. And it was just so insanely like life-changing because I was so close to leaving a career that I was so in love with. So I go to training, and the first class that I go to is before MFR1. It was a special class that you didn't need any prerequisites. It was specific to the pelvis and the legs. And I'm in class, and all these people, like a lot of these people had taken multiple classes at the time, and I'm hearing yells, I'm seeing people like flail limbs. I'm like, is this person having a seizure, or this person like having a heart attack? I remember asking this to the person that I was treating, and they're like, no, that they're unwinding. And so I'm like, what is unwinding? And that's where this conversation gets more interesting. So basically, myofascial release exposed me to our body's internal mechanisms of self-healing. And it is, from an observer that doesn't understand what's happening, could be frightening, but is actually just so freeing to the individual that is being treated.
Yeah.
So,
like, you want to, like, have the best trip of your life and growth without having to take drugs to do it?
yeah,
This is what this literally soft tissue work can do for you.
Yeah.
And I'll touch on my personal experience in a second, but yeah.
So anyways, I'm like, this is just me getting my feet wet. And I come back and I start working for the woman, or the group of that helped me get my life back together. And at that time, they're like, just wait till you get to MFR1 and unwinding, and MFR2, you'll have a better understanding. And they were talking about whenever they were treating me, and as they were mentoring me, they're like, you really just have to quiet down. You like, don't think, don't talk, just feel. And that was a concept that I wasn't really aware of.
Yeah.
And at the time, I also didn't know what it meant to meditate. And people would tell me to meditate all the time. They're like, you just need to meditate. I'm like, what the hell are you talking about? And what they were talking about was shut up and just listen, feel without thinking, quiet down. So I go to MFR1, and I feel like I have to share this story because I am a completely different person now because of John Barnes, because of Amy, because of Melissa, because of Myofascial Release. My life is different. I am quiet. I am not this like I have to be moving all the time person because of this. And I've been on ADHD medication my entire 20s. Like, it's been now I'm going on 15 years, and I don't have to take it. I don't have to take the medication really anymore. And it's getting more and more as I continue to be treated. And I thought that was the only way I could function in a day. So anyways, I get to MFR1, and John Barnes talks about this channel 3, channel 5. And he talks about how we have thinking intelligence and how we have feeling intelligence. And
he describes them as like channel 5 being our thinking intelligence,
yes,
our left brain that wants to think about the past, think about the future, think about...
It's anxious, it's judgmental, it's fearful, it's handy at times, but that's not the state we need to be in, or we should be in for our whole, all the time. Then the channel 3, and he just labels it that way, is our feeling intelligence. And that's our feeling intelligence is connected to our body so that we can experience a situation and let it go. And basically listen to our intuitive powers to live our life. And I think we all can relate to this. We are taught from such an early age to not feel, whether that was, or to shut up. Like, I was told to shut up, stop crying, this and that from long as I can remember. And that feeling was a weakness as an athlete. Now, being able to dissociate from the feeling intelligence is really key to surviving. So think of a moment where maybe you were in a car accident, or maybe you had a fall, and the body goes into shock, or basically, in order to survive, our feeling intelligence basically leaves our body to get through the experience. And
like if you've had a traumatic car accident, you felt no pain on impact. You felt no, and then you kind of have this come to, okay, and it's not just because you had a concussion or whatever, you could have even been totally aware, but just not have felt what you normally would experience in terms of physical pain in that moment.
Yeah. And that's important, but that's not how you're supposed to stay. That has to come back within a few hours or a few days, not forever. But what happens is we get so good at staying out of our feeling intelligence that's the way that we are just at all times. So here,
I think another way though, that even let's say, because I know for some people, right, they haven't fully gotten into the energetic side of things, and even there's science behind all of it and quantum physics and stuff like that, but haven't gotten into that. So even using the word dissociating, in psychology terms, right? Dissociating, which is you're basically removing yourself from your body. You're tuning out.
Yeah, tuning out.
And that's why people also too have these blocks that they don't remember of their life.
Yeah. Or they just don't feel anything. Unless it's so intense that they feel pressure, they feel something, but it takes so much, and it's not that true feeling intelligence. So anyways, this is the backstory. And you basically have to get out of your own way, get out of your head and into your body while you're being treated. So here I'm being treated, and there was a time whenever I was in college where I fell down wood stairs into concrete floor head first. And I popped up, and I remember being upstairs in a room being surrounded by people looking at me and trying to get me to be, coherent and conscious. And when I was in MFR, my MFR 1 years ago, and unwinding, I was taken back into that moment where there's a big hole.
So basically you're telling me in the midst of you just being treated with the myofascial work, you're quieting your mind, right? And then all of a sudden this flood of memories comes back to that moment.
Memories and movements.
Okay.
So as I was being treated, my body I wasn't consciously do this, do that, but what now I understand to be my thinking intelligence took a back seat and allowed the feeling intelligence to let go. And in order to let go, I was assuming these positions. So I was at a position of impact from years that fall, and then there were other positions that I was getting into, and these are called still points. Still points are when, moment of impact, you freeze, and then after impact, what happens? So there's multiple, it's different for everything, but at those moments, when I'm treating someone, people will stop moving, and it doesn't always require movement. Often it doesn't, but my body was processing. So from a practitioner, what they share, they're this is what happening. This was in your body. You were getting red here. Your eyes were fluttering. And right then and there, my body was processing and basically letting that stuff go. Mm-hmm. So after that experience, and I was a huge skeptic, going into this, because I hadn't experienced it for myself. I felt all the benefits, but I'm what is this?
The unwinding piece, right?
Yeah. And after that, I'm wow. It took me, so after being treated, when the tissues opened up, when there's releases in the fascial system, it puts the body into chaos, because now instead of being this solidified or very, very crystallized area, it's fluid and things are flooding in. There's information coming in. So we call it a healing crisis. And being that we're higher functioning people, we are able, we adapt to be basically better than where we were before. So that's that upward progressing wave form that I referred to earlier. And after that, man, that's when the needle started to really shift. Like the way that I was able to be quiet, I was able to feel instead of constantly my mind was racing. And I continued to be treated because there was more classes, and then I was working at a clinic and we treated each other. And it just got better, it got better, it got better. All of my problems, like painful sex, continued to get better. And then, I mean, my ability to treat and just like to quiet down and to feel and when I'm treating someone else, it just exploded. And it has just completely altered the state of my career. I was so afraid to go off on my own. Since then, I've started the Vagina Doc, where I'm in a completely my own space. Everything that I was afraid to do, I've done. And that was my experience. I continue to have just amazing experience with MFR. And I just want to share it with everyone. But it's like it's so hard to put into words.
Yeah. And the thing is, though, like, I want to applaud you, though, for, like, speaking openly, right? Because I think a lot of times when people have these really life-changing things, it wasn't just a physical change. It was like your inner self, your perception of the world changed from having also this experience and these kind of releases, essentially, right? Like everyone, like people might go to therapy, let's say, right, for years and years and years, looking for what you got to feel and what you got to experience in terms of your mind quieting down, not buzzing all the time. You basically like letting go of stuff like fear of like that was holding you back from doing things you wanted to do in life. And people literally will pay somebody and do this. Like, not to say that therapy can't be beneficial, right, at certain points, but for most people, I think they're running in circles. And like to have an experience like you did, one, I think it's not always easy to talk about because not everyone can understand and like resonate. But people who I think are ready and need this kind of work will completely resonate with your story. And so thank you for just, I would say, sharing like what you had to say.
And the crazy thing is, I knew that being a healthcare provider, I knew the like what it means to hit your head as hard as I did. I'm surprised I'm not dead. And I won't go into the full spiritual part of that because I don't want to scare people off. But I believe like a part of my like essence left at that point and didn't come back. Like after that, I got car sick. I had extreme, I mean, I don't even know how to explain this. I would crawl up stadium stairs, like a basketball stadium. The steepness, something would come over my body and I would like go into panic attacks. One time I was hiking in Washington and it was off like, if I looked down, it was a big slope and I was like hugging the ground because I was panicking that I was going to fall. I'm like, where is this coming from? It had to have come from some of these head injuries. And the other thing is like, I had no life. Ask anyone who I went to Camelback CrossFit with. I worked from the time I woke up. I would go to the gym and I would still be working at the gym and I would work until I'd go to bed. And sometimes I wake up in the middle of the night and I'm like, oh, something about work. I'm going to go do that now so I don't forget it. And I didn't have a life. No life. I would literally think about work at all times. And if I wasn't working, I'd be anxious that I wasn't working. And since then, I have given opened up something that has given me permission to take care of myself. To now, work is work. I love what I do, but I love my leisure time and self-care time and exploration time. Yeah. And I think there was nothing else changed in my life except Myofascial Release. And so I was so excited. Whenever I introduced it to Jordan, I was like, hey, you want to go take these classes? I didn't really tell her anything because it's so hard to explain. You just have to experience. And you have to just let go and receive. And she just did. And I was so proud of you because it's scary to let go of control. And in order to you'll get something out of the structure work, but to get the most out of it, you have to let go.
And honestly, thinking like it's interesting, stuff's coming to me right now as you're saying this, like, obviously, you know, things I've been through in my kind of life up until MFR over the last, let's say, year, essentially, year and a half. I don't know if I would have been ready to let go as much as I did going through MFR had I not been in the right place and state for MFR to come, you know, like gone through those things and then had basically gone to this, like, learn MFR. I don't know if I would have gotten as much out of it had I not been through those things prior that had kind of set me up for letting go of control, because there were experiences that happened to me previously that, like, I basically wanted the unknown in my life. I didn't want to control anymore. And so I'd already kind of been in that place of like, gosh, like just keep letting go of control, because me trying to control everything in my life wasn't working.
Yeah.
And so when we went to the MFR, and you're right, I didn't know really anything
nothing.
other than you doing abdominal work. Like, she was like, oh, you want to do like this 11-day thing? And I didn't even look anything up. I didn't even like, I was just like, yeah, let's do it. Like, I always want to learn. And so far it's been helpful with what you've done on me. So
yeah, share your experience. Like, because I feel like I've been in this for so long now, you being fresh, like, what was it like for you? Being a chiropractor is and someone that is in functional nutrition, and then being exposed to all this.
Yeah.
She was the only chiropractor in the class, by the way.
It was, and it's like you said, there's almost no words, because I came in, right, and I'm always doing my best to be open-minded to learn, because I always think there's something to learn.
Yeah.
You don't know everything. And I didn't realize, and I was hearing like everything John was saying, and like even getting to the science of things, I was so interested and fascinated with all of that. But it really wasn't until like we started treating each other. And it's interesting because before coming to the seminar and learning, I'd had other experiences in the past where maybe I'd be meditating, or maybe someone would be doing soft tissue work on me, and I'd kind of feel like this little bit of a buzz through my system. Like almost like I'd feel little places like jolt on me, or like kind of like almost like this wave of movement through my body where I'd almost kind of feel like I was wanting to shake a little bit. And, you know, when I'd feel those things prior, I'd kind of get nervous and like try and stop them essentially. And so
why would you try to stop them? Because I think, I did it too.
Because
you're just like, why is this moving?
Yeah, and you don't like, you think it's socially unacceptable because we're not used to like, if something is kind of coming up, instead of being curious about it and letting it kind of come to fruition and follow through, we automatically are like, oh no, I don't know what this is. Like, must be bad or something, right? Like,
shove it down.
Yeah, shove it down. Let's just not deal with it. And like not wanting to freak out the practitioner, you know, and tell them like, oh, I'm having this weird buzzing through my body, and them seeing like things kind of like vibrate on me. So that's why I'd shut it down. But when I was at the seminar and we were starting to treat each other and I was feeling that buzz again, and when John was like, let go of control. And I remember...
Take your brakes off.
Take your brakes off, loves to say that. But telling myself, like, let go. You're safe. What's the worst thing that could happen if I let go of the brakes and I let go of control? Well, the worst thing that could happen was I'd have an amazing freaking experience. And, like, basically, when I let go of control, that buzzing turned into my body starting to move in positions that I was not moving it into. I was on purpose. I was like, okay, from a science perspective, let me just be the observer of my body. Let me just let my body do whatever it's going to do and me observe it. And that's exactly what I did. And I started moving into different positions and vocally, and I was getting beat red in places that people weren't touching. And so because of that, they would go then, right, like almost like there's a lot of metabolic activity happening in that area, which usually has to do with a restriction. A lot of it around my throat, a lot of it around my chest.
We call it the fascial voice. It basically is your body saying, this is where I need it next.
Yes, I need to be kind of have your hands doing work on next. And so as I kept letting go of control, and even like it was so helpful with some of these practitioners who are more experienced and have done this, who like would tell me like when they could tell that there was like I'd be moving, but maybe like it'd almost be like something vocally wanted to come out. And again, I was almost controlling
Yeah.
because who knows what's going to come out if I just let it come out. And so when they were like, let it out, like you're safe. And again, I just briefly checked in with myself and I was like, let go of control. Like whatever is going to come out, let it come out. And I started saying things that I wasn't even thinking of, like words started coming out like, I'm sorry, I'm sorry, I'm sorry, I'm sorry. And then I would like something like other movements would start happening and I'd get to a freeze point. And like, it was just amazing because all of it, like, and some of throughout the week or 11 days we were there getting treated, I was having flashbacks of memories, like stuff that I don't think about. And we don't always view things in our past as like a traumatic event, right? Your left brain is like, oh, that was dumb, couldn't have been trauma.
Yeah.
But things coming up for me that I was like, oh my gosh, like I don't think about this, and it's coming up, and this thing that maybe I thought was resolved wasn't. And so it was really cool for me to have like these random memories as I'm going through this experience come up for me, and allowing myself to like vocally get things out. And I think
vocally is vocals or movement. So
yeah, no, 100%. And I think that's where a lot of us honestly get most restricted throughout our life is, again, being told, be quiet, don't say that, don't do this, don't say that. Like, because culturally everyone's trying to just keep with whatever the norm and makes everyone feel okay inside. But really, like, when we restrict, like, I realized a lot of like my restrictions around my throat, my chest really come from that growing up, being told like it doesn't matter what you say. And having these things like told to us, that does affect us. Like when we think about our brain and our like emotions and what really drives what we do in our actions, your conscious brain is just the tip of the iceberg controlling what you do. It is the unconscious, subconscious messages that we have been taught and fed our whole life that are really the big drivers. And that's where, again, like a lot of those trauma and things are held because your left brain and the conscious part's going to tell you, oh, you're fine. Those things didn't affect you. Like, you're strong. You can keep moving on.
Yeah.
And so I just have realized, like, after having a lot of these releases, again, like it just felt like another leap for myself, another leap in terms of how I felt about myself, how I viewed the world, and a bigger leap of letting go of control in my life and not having to control everything, not having as much fear, because knowing when you let go of control, yeah, there could be like, I even remember after a few treatments, like not feeling right for about 24 hours, like feeling just disrupted.
Yeah.
But instead of like pushing that aside, like I just kind of let myself be in it. And trying to listen to my intuition, you know, and my intuition at different points being like, okay, maybe go do this now, to help kind of basically guide me out of whatever emotional release I'd happened and working through it. Sometimes it's like, go sit by yourself, like outside in a space and just kind of look around. But basically my experience through this has been life-changing. And I'm just excited to now, since coming back from the seminar, I've been treating myself daily. I've been even having my own unwindings, which is beautiful to be able to have that even on my own. And seeing how patients are now responding to it. And it is so interesting because sometimes patients, again, I'm not telling them, hey, like you could have all these movements and all these past memories come up and there could be this big emotional release because I'm working on, you know, just the fascial system. But it's been so interesting even so far to see patients that like I can see different parts of their body twitching and they almost kind of look like they're in a meditative state. We're not talking, right? But they almost look in a meditative state. And I'm watching even like patient the other day, like doing a release at their head and neck. And I'm watching this person's head just like slowly move to this side, pause, slowly drift back to the other side. And I'm just kind of following it and just maintaining, seeing all of a sudden like a leg shaking. And all my patients so far that I've been seeing this with, and again, not telling them about these big emotional releases, like they'll, you know, we'll be done with the session. I'll be like, so did you feel anything? And they're like, so far, like a lot of the people, because this is all very new and they don't, I don't know why, but they're like, no, I didn't feel anything. And I was like, oh, so you didn't feel your neck moving all over the place? No. You didn't feel that your legs shaking like what I was visibly seeing? No. So it's just been really interesting to see, I think, you know, the body processing these things. And I think partly like, again, because we're so out of our bodies because of what we go through in life and what we are told and taught, that we don't even feel what our body is sometimes doing. Like we are
Yep.
so almost like far away that the body is like doing all these things. And again, it's the feeling part of you
Yep.
that's like allowing all this to kind of take over your actual physical body. And so it's just been exciting and interesting for me to see. And so far patients have just been having amazing results in terms of how they're feeling and doing with even just, you know,
Right.
short time I've been doing this work now.
So how, being that you're a chiropractor and you work, so you have your chiropractic side and then you also have your nutritional side, how has this changed your practice? And I'll share how it's changed mine as well afterward.
Well, I know just from like the work you've done on my abdomen and seeing bowel movement changes and like things change that nutritionally, you know, if something comes up for me and I'm figuring out this or that and introducing stuff, maybe taking stuff out and I'm not seeing changes, then all of a sudden you put your hands on my abdomen, start doing some work, and it's like all of a sudden my bowels are like normal again, essentially. Like it just, in learning what I've learned so far, you know, with how restricting the fascia can be in terms of the cells and getting nutrients in and out, like this is something that I'm recommending now to all my nutritional patients, because I think it's going to take, yes, the chemical work that I think is important, but just take it to a whole nother level in terms of how they're going to respond and feel. And hopefully my goal is always never to have my patients on supplements. That's just supposed to be a support for your normal system to do what it needs to get healthy again. So I feel like patients are really going to respond and not need to be on as much stuff and potentially like get off things a lot sooner and have like much drastic like healing going on. So
How about for your adjustments?
well, the adjustments have always been just a small part of what I do. I'm not the chiropractor that's lay on the table, rat crack, and you're out. That's never been what I do. That's why my visits are anywhere from 30 minutes to an hour, and we're working on neuro stuff, we're working on movement stuff, soft tissue stuff. But I mean, even now I'm using the adjustments way more sparingly because I'm realizing that when I'm working on the fascial system now, like, and we all know, right, like what pulls a bone out of place, a joint out of place? Muscles. What's, you know, pulling that out of place? Is it the nervous system? What's, you know, and is it the fascial system, essentially, old traumas? So I'm seeing just patients are basically being more balanced. They aren't having, you know, the same, let's say, things needing to get adjusted. I'm noticing movement elsewhere that's like positive. And after doing these MFR sessions, I might only now, when I'm going back and feeling, find one place that I'm like, okay, this is where I'm feeling like we need to do the adjustment. So, yeah.
Wow. So for me, I used to dry needle a lot more, but do a lot less dry needling. Now I know there's utility with certain people, certain areas with that, but I'm not completely stopped it, but for the most part, I think dry needling puts a lot of people in a fight or flight state, and healing doesn't happen there.
Yeah.
So my framework is it usually takes about, and it depends, everyone's different. People that have had just things on things on things, it's going to be more than this. But I say minimum of 2 to 4 MFR sessions, that's where we're focusing on. And then we reteach, your system's going to be open, then it's going to be more responsive to me teaching you how to reconnect to your core. So framework is MFR to open up the system, improve your recruitment capability. While you're doing the MFR, you're working on coming home into your body and being more in tune to your feeling intelligence. Because a lot of times when I'm working with someone, I'm like, where do you feel this?
Yeah.
I'm like, oh, I don't feel it. And I'm like, ugh. And this MFR teaches you that.
Yeah.
Teaches you how to meditate. Taught me how to meditate. So the cool things about myofascial release is it's not a force, so your body doesn't get defensive over it.
So you can't ever hurt anyone.
No.
You're not placing a force, like a strong force into the system.
Right. It will never hurt you or harm you. You will experience therapeutic pain, which is necessary to feel in order to get rid of it or move past it.
Yeah.
And John says, if you feel really good after this, I mean, of course you could feel good, but usually it gets worse before it gets better because of the chaos, and then it gets really good.
Well, because you're bringing people back into their bodies where they haven't been, so they're experiencing what they haven't basically fully gotten to experience and heal yet from,
Right.
It's like they're coming back and the body's like, okay, this is what you've been missing out on. Like, let me dose you with it so you know, but you move past it. You know what I mean? You keep getting treated and these things resolve, but you have to feel it because you haven't felt it.
Right. Second, the cool thing is it teaches you a different lifestyle. So myofascial release becomes a lifestyle, meaning being in your feeling intelligence, trusting yourself, learning to let go of control. So you learn that when you're being treated, but then you learn that you learn to apply it towards your life, and that's where it really becomes just transformational for people.
And I think what's really cool is because, again, if you do myofascial release right, which is not forcing the tissues to do something, and you can't hurt anyone with doing this, it's made me like, everyone needs myofascial release. Babies, from the time they first come out, they have their traumas from the birthing process. They respond great to myofascial release. I got to treat my first babies this week, and it was really amazing to like feel the tissues in this baby just give, and to feel even like vertebra and cranial bones start to slowly shift or slide back to where they were supposed to be. And I could see this baby just like relaxing and just totally loving it. And it, like, the mom's like, oh, she doesn't really like being on her stomach. Baby, I have her on her stomach to do some of the work, and the baby's like knocking out basically.
I know.
So,
and the great thing about the younger you start, you don't have the BS in the way. Like, gosh, it took me forever to just let go. And it takes a lot of people let go. What's the worst that could happen? Oh, you start crying. I'm not going to tell you to shut up. I'm not going to give you a tissue if they're going to stop crying. I say, you better let that out, because if you don't, it's basically it's affecting the work that I'm doing here. And so the question that I asked that when we were in Sedona to John was like, okay, people are on a budget and they're going to want to know how many visits.
And especially when like practitioners like us, like, we're not in the insurance system.
This can't
like,
be done with an insurance-based system. You could do a little structural work, but like the holistic approach, no way. And he's like, it depends. It's up to you how much. The harder, or the more resistance, the more you fight yourself, the more like.
So it's up to the patient, is what you're saying, is how much, because it's like, how much are they invested? But also, like,
are you going to treat yourself? Are you going to quiet down? Are you going to take your breaks off?
Are you going to listen and apply, essentially? And like apply the self-treating, because again, like, we know it takes patients treating themselves at home to speed up this work, and to have, like, you know, if they want to save money, self-treat yourself daily doing this, you know, like, that's one way that they can save money. Like, yes, like, we're going to do a big chunk of work in the hour that we have, especially with us, how we're starting to co-treat a lot of patients and have 4 hands on people instead of 2. But like, self-treat yourself and you'll save a lot of money, essentially. Like, take that time, and what it's going to force people to do, and this is where we're always kind of weeding people out, right? Because there's a certain type of people we want to work with. We want to work with people who want to do the work and love themselves enough, and or at least on that journey and path that they're like, yes, like, give me the things like that I need to do to help myself to heal. And so, like, those are the people we really like are wanting to work with. But those are the people who benefit from this kind of work, is because they take the time to treat themselves, to love themselves enough to do it, instead of honestly making excuses. Oh, I have this busy schedule, I have this, I have that. I'm sorry, but we make things a priority in our life that are a priority. We choose to spend our time where we make things a priority. And treating yourself doesn't have to take an hour a day. It could take 5 to 10 minutes.
5 to 10 minutes.
But you'd be amazed at how many people will not even take that time for themselves.
And this is, you know, I like to tell people, this is, you're going to come in for a chunk of time, then you're going to continue the work on your own, and then you're going to have something happen in your life, whether it be a growth experience or whatever, and you're going to kind of fall off the wagon. We all do, but you're not going to go all the way back to where you were, but you'll need to tune up, and then we go even deeper this next time. It's like you become more receptive every time you come in, if you're open to it. Now, if you're not open to it, we're not your people.
Well, no, because like, again, like, people who are looking for personal growth, and that includes like physical growth, right? Like the way that honestly it seems like your kind of body is like a physical manifestation of how you feel about yourself, how much kind of self-care and love you have. And that doesn't mean that you couldn't have things you're born with or stuff like that, but I just mean overall, there seems to be kind of that trending theme. Like you can tell kind of who doesn't, you know, take care of themselves, and it's because they don't love themselves enough to do it.
I mean, the things that we hear people say about themselves, and
self-talk, the things that they say, like,
geez.
oh, I'm not good at this, or I feel stuck in this, and it's just like, and not, again, like we can all go through different points in our life where we have hard things, but a lot of times it just seems like, well, what's your perception of that hard thing? Are you looking at it from that perspective of like, what is this going to do for me? How can I grow from this? Versus why me? And like kind of going into the victim mentality. And that doesn't mean you can't be sad or upset and like take that time to sit and resonate in that. But also then there's that side of like changing your perspective and just having that little bit of a shift of like, how is this going to benefit me? But either way, sorry, I'm getting a little off track here, but we like working with people who just have that growth mindset.
Yeah. So if this is something that you're interested in, or you're thinking about wanting to be seen, here's a starting point. Just start to get quiet in your body and do a scan. See where see what you feel just being quiet. Like, do you feel a low level buzzing somewhere? Do you feel heat somewhere? And then when you're tense up everything and then soften.
I was about to say, like, if you would just quiet yourself and you can't feel anything, then I was going to recommend try the next thing, which would be tense every part of your body, scrunch your face, squeeze your butt, like tighten your toes, everything, and then let everything try and relax and notice wherever you still are holding tension.
Or the just tightens right back up. Yeah. That's a good starting point. But we're just, because her and I together are just such a powerful team that can literally accelerate people's growth, their health, we are going to have our own, or a separate thing where we're exclusively co-treating. And so to launch that, we are offering a wellness evaluation. It's $399, valued at over $650. Yeah. So it's for $399, and
2
then
hours.
That includes looking at your movement, looking at doing a sample of sensitivity testing, and also
looking at doing a neurologic screen, because that's my background with the neurology stuff. So seeing how your brain is connecting with your body from your senses, like your eyes, inner ears, things like that.
And screening your pelvic and abdominal health. And thereafter, we have introductory packages for myofascial release and just the care that we provide as a team. And if you're interested in that, we're only offering a limited amount of
this pricing.
Yep. So don't delay in reaching out.
And we'll, like, with all of our patients, we always want to make sure it's a good fit fit for them, a good fit for us. We don't want to waste anyone's time. So we're always willing to do a free 30-minute consult, speak with you over the phone, hear what you have going on, answer any questions. There's no obligation to have to basically schedule. It's just let us hear what you have going on, make sure it's a good fit, make sure this is going to work for you. And then at that point, if it is for everyone, then you get on the schedule and we move forward with the process. So yeah.
So, anything else?
No, I'm just super excited about what we're going to basically be doing and the people that we're going to help and the way that we're going to help them. And I think it's going to be a totally different way than they've ever been kind of helped and exposed to before with this kind of work. So, it's exciting for me.
So, the ways to reach us, you can follow us on Instagram. My Instagram is at the.vaginadoc. Her Instagram is at Transcend Wellness Chiropractic. Yep. We both have individual websites for now. Mine's thevaginadoc.com.
And mine's just my name, Transcend Wellness Chiropractic. So.
And then you also can shoot us a text. We'll put put that information in the show notes. But thank you so much for listening or for watching. Let us know what you want to hear for next time. And usually I say until next time on Real Talk with the Pelvic Docs. But
I don't have a cool tagline like that.
We're still working on it.